For us in dentistry today, whenever you're missing a tooth, one of the first things we want to look at is how can we replace it. And the dental implant right now, in most cases, is the standard of care. It's what's to be expected. Let's say that you fell and broke a tooth. In our office, what we do is we bring you in on a referral from your general dentist or a referral from a family member or patient. We bring you in, we get x-rays, we evaluate what the condition of the surrounding bone is. We remove the tooth, oftentimes place the implant at the same time and place the temporary on the implant, so you walk out that day with a replacement, not the permanent one, not the final one, but a aesthetic replacement. Now the other one is you've had the tooth lost in the past. On that process, we bring you in, evaluate if one implant's all you need or if you need several, evaluate your occlusion, how your teeth hit together. We evaluate where the best place to put the implant is. We like to use little sedation so you're unaware of the length of time the procedure, so you don't feel any shock, so it can be stress-free. And then we place the implant. We normally see you in about a week after that to see how the healing of the gum tissue is. And then we normally see you in about 8 weeks after that to see how the bone is growing around it. When we first started doing implants, it took up to 9 months before the bone grew around the implant. But now, due to all the advances, we're looking at restoring implants most of the time in about 8 weeks. So you'll have your permanent crown in about 8 to 10 weeks. Say the far reach where they've lost all their teeth and they're in that embarrassing stage of wearing a denture that never quite, even the most perfect denture is still removable. There's always that worry, that lack of confidence. And also, it's just harder to eat things. The nice thing about implants is that it helps give you that confidence in your day-to-day work that the denture's not going to come out. Use that confidence when you're eating and talking, that you didn't have before. One of my greatest motivations of doing implants was a woman who, in her teens, had a horse knock out her front 2 teeth and it had a removable prosthesis, a flipper, a partial. And we placed the implants and her general dentist placed the crowns, and I was there for the crown placement. And she got teary-eyed. And I thought, oh my gosh, she doesn't like them. But she said, no, I love them. This is the first time I've felt clean in 30 years. It's one of the most changing procedures that we do.